Pennsylvania physician Jean Santo has been trying to relieve pain for 20 years, using every medical tool available.
I use all kinds of injections, I use all kinds of medications, I refer out to multiple other specialists, and there always remained a number of patients that just weren't getting better.
Is that a problem to you as I move the hip around?
So I've always had my eye open for something that could treat those patients, and I think I found it.
What she found is the cutting-edge MLS laser, which uses light to alleviate pain.
What makes the cutting-edge laser unique is the multi-wave lock system. Basically, they've taken an 808 and 905 wavelengths and they've synchronized them. The tissue absorbs those wavelengths and that light triggers metabolic reactions in the cell that stimulate healing, that stimulate reduced inflammation, and stimulate pain reduction.
One of Dr. Santo's patients is Lisa Knott.
Hi, I'm here for my appointment today at 1 o'clock.
She has suffered from debilitating back and hip pain since high school.
The pain is absolutely immobilizing. I cannot, even at times, get out of bed.
After trying nearly everything else, Lisa recently began treatment with the MLS therapy laser.
The same day that I have my treatment, I see significant results. My pain is definitely less, and I have more mobility.
It's been shown to reduce muscle pain, muscle fatigue. It improves wound healing, it reduces pain, and I think it will be standard in pain practices. Even regular primary care offices, I think it'll be standard.
Halfway across the country in Arizona, highly respected podiatrist Dr. Richard Jacoby has seen similar results.
It's a pretty amazing instrument. We call it the magic wand. A lot of patients come in who have had treatments for years, and they have instant relief of pain.
I noticed the swelling went down right away, and the pain was definitely less from one treatment. Yeah, I was amazed.
Those treatments offer not only medical benefits, but also financial ones. Dr. Santo expects her cutting-edge laser to pay for itself in less than a year.
I charge $60 for a treatment. Being paid in cash the day of treatment is a godsend. You know, I don't have to bill for this. I don't have to pay a billing company to collect it for me. I don't have to go after insurance companies or patients to get paid past balances. I'm taking in a fair amount of money right now, and I haven't really even mentioned it to anybody outside of my current patients.
When you're talking about your quality of life, there is no amount of money that you can put a price tag on that. Your quality of life is important. And if you can't travel, if you can't work, if you can't go to the movies and sit for 2 hours, you know, it's worth $60 an hour, for a treatment for me, any day of the week.
Money is really not a problem with this, because patients are very, very willing to pay for this because it's something actually cheaper than their traditional treatments.
More and more doctors are using MLS laser therapy. They consider it an indispensable part of practicing medicine.
I see light as the medicine of the future, really. That light therapy will revolutionize the way we treat certain conditions. I think the cutting edge is wise to be in the forefront of that, and I think the pain doctors everywhere should be looking into this as a benefit to their practice, and particularly because it's the right thing to do for your patient.
This is probably the most transformative modality to come down the medical pathway in the last 50 years. It's that transformative.